Watching TVC Breakfast, we're now about to go into this very concerning conversation. Now, the death of Chimamanda Adichie's son has renewed concerns about hospital standards and medical safety. While details of the case remain unconfirmed, the situation underscores long-standing concerns about delayed treatment, inadequate monitoring, staff shortages, and equipment failure in some hospitals. At the center of the issue are questions about timely medical response, quality of care, staff competence, and emergency protocols in hospitals. In critical cases, delay, poor monitoring, or inadequate equipment can be fatal. This situation highlights the need for strict adherence to safety procedures, proper supervision, clear accountability, and regular hospital audits to prevent avoidable deaths. Joining us via Zoom for this conversation, he's all the way in USA. He's the convener, Social Rehabilitation, Grace and Support Initiative, Dr. Oludare Marindoti. Good morning, Mr. Marindoti. How are you doing?
I'm good, Rhea. Good morning, everybody.
Good morning, good morning, good morning. Happy New Year to you. Yes, I haven't seen you this year. We're starting with this very sad conversation. During the newspaper review, we're speaking about the woman in Kano State that a scissors was left, in her tummy. That, we talk about negligence as well. We all saw what happened with Chimamanda Adichie's son. 21-month-old baby passed away. They are alleged negligence as well. Oftentimes, we've spoken about our medical care in Nigeria. We say our doctors are burned out. Oftentimes we see them go on strike. But is that a reason for the kind of gross negligence that we see? I hope that this case will just bring about more accountability from our doctors. Mr. Marindoti, over to you.
Yeah, thank you very much. It's a very sad, tragic case that happened to Chimamanda Adichie, but, there's a lot of Nigerians that have experienced such. I will start by mentioning a case that actually TVC covered in 2020 of a lady who called Onyekon. She actually told me to mention this when she saw that I was going to be here today. And, she had a C-section during that period. They wanted to give a spinal anesthesia to do where they go through your back, but it didn't work. After repeated attempts, instead of, switching over to general, they injured the spinal cord, which caused, she couldn't feel pain, pressure. And because she could not move, she had a pulmonary embolism. We tried to give an anticoagulant, but the insurance declined the second dose. But maybe because of the first dose, she was able to survive that, emergency. But then due to poor nursing care, also she had a blister on the sole of her feet. Now, eventually, when this woman was discharged, about 65 days after, she discovered that something was left in her stomach, like a pack was left in her uterus, like at surgery that had to be removed. Now, think about this kind of situation. This lady went to court. I think according to the reports by TVC then, the hospital offered her 500,000. And I'm sure even you can agree that 500,000 in 2020 is not going to cater for what this woman was going through, because she had to use the walking stick. And guess what this outcome of the case was? It is undecided. The case was handled by Festus Keyamo, the Minister of Transportation's chamber. And so this woman had to leave Nigeria. She's somewhere in the West. So this is something that occurs. But, now it is easy for us to sit here and be this, Monday morning or next day striker. Female should have passed the ball. It's a different thing when you are in the heat of the matter and you are dealing with these cases. So when you look at the case of Chimamanda Adichie right now, in my own opinion, at least from the way I practiced when I did, if I am referring somebody to another hospital, once I make that decision, I stabilize and transfer and refer. When the parents made the decision that they wanted to refer their child to Harvard, the hospital, in my own opinion, should have, made that decision to just stabilize and transfer, as opposed to, going for the MRIs, lumbar puncture, because a lot of these reports and the results will not come out by the time the boy is going to get to the United States in the first place. So, in my own opinion, if Harvard is deciding what they wanted, they should do it when the patient gets there. They should have just stabilized, maybe with the central line and transfer. But, it is easy to say that right now with the benefit of 2020 hindsight, right? At the point of making that decision, the doctor was definitely not thinking he was going to kill the boy. We don't even know what happened here, because the detailed investigation is going to be needed to determine. Propofol is the same drug that killed Michael Jackson. The nickname is called Jackson juice. It works fast, it wears off fast, but you have to monitor the patients all through. So it might have been that there was a lag in monitoring. Now, according to the report from Chimamanda herself, she said the doctor carried the baby on her shoulder. Something that seemed like a calm and warm, gesture of the doctor, carrying your baby affectionately, now might be a liability for the doctor. We don't know yet. We need to investigate. But like you have said, the most important thing is that the hospitals are understaffed, underfunded, and to me, and I've said this for a very long time, the federal government, not just the federal government, the government in general is playing a very crucial, deleterious, impact, having a crucial, deleterious impact and playing that role in the healthcare administration of Nigeria in general. In my own opinion, at least from my own experience, my father is a doctor, whom I was born in his hospital. From my own experience, the healthcare sector under the military regime was way better than it is under the democracy regime, because they have tried to turn healthcare into a propaganda. So the things that are needed are not being done. Yeah. One of the things that is causing the shortage of healthcare right now is training. And that training they started reducing the number of all healthcare workers, the training of healthcare workers since 2008 when I was in part 3. So by the time I was in part 4, OAU, the university I went to, that used to employ admit about 300 students. They reduced it to 100. Some universities have just 6. And this, I was replete with stupidity as a 19-year-old boy at the time. But even me at that time, I was wise enough to know that this is going to cause problem in the future. If they said they were making half-baked doctors, if the cake is bad, do you blame the cake, or you blame the oven, or you blame the baker?
Very serious questions you've asked there.
That we need to those are things we need to address.
Yes, but you see, the Eurocare hospital is not just your regular off-the-mill hospital. It is a good hospital by Nigerian standards, and I think by international standards too. Now, one of the things that they are accusing the hospital of doing is overdosing the baby with anesthesia, which caused a cardiac arrest. You can imagine a 21-month-old child suffering a cardiac arrest. Let's go into training, and monitoring. We have internal monitoring systems in hospitals, I believe, and we also have external monitoring systems too. The problem is the external monitoring systems. Could you speak to that?
Yeah, so, when we talk about the internal monitoring system, it's always after the fact. And the external monitoring system will be after the fact. The external monitoring system is maybe what you would expect FEMA or some other, MDCN to be doing. So it is essentially about creating protocols that are going to be monitored. So you have to have, prepared and have protocols on how these things are done, which most of these hospitals have to. But sometimes they might just be guilty of overcompensating because, this doctor has the VIP's child, might have wanted to over-impress or whatever, and then maybe did too much. He could have used diazepam, he chose propofol. They could have monitored, maybe they turned off the oxygen, maybe they thought it has worn off, because this drug, everybody have different, ways of metabolizing drugs. I know of a boy, a 3-year-old boy who used propofol for a surgery in Akube a few days ago. Do you get? About last week. So it's not like this drug is contraindicated in children, but people metabolize drugs differently. You don't know whatever medication that the boy might have taken before it was, referred there. You don't know what state. The boy could have, the boy could have even had COVID or whatever, whereby, so many things could have happened. So we don't know. An investigation is going to be what determines what all these things. But even though Iraq, I worked in a hospital in Victoria Island. It is in the same cadre as the Iraq and all these hospitals that you're talking about. But even those people have staff shortages too, because they are constrained. So, and the staff shortages in hospitals, sometimes they call in people when they have more patients. But these people, because they have constraints, they might have other patients that the nurses that are supposed to be, in front of the baby, monitoring him up until he wakes up 100%, might have been distracted by saving another person's life. We don't know what happened, definitely. So these are some of the, and nobody will anticipate that the way the body was going to metabolize the drug will go in that direction. To me, I don't know yet, but I feel like it might be the lack of monitoring that delayed the intervention that might have saved that boy's life, right? Yeah. But yes, and this thing goes back to that shortage of staff. which goes back to the federal government through the MDCN, restricting the number of healthcare professionals that you have been training for over 18 years. And then definitely with the payments problem and all those things, a lot of doctors like myself, we had to leave. I can tell you that if you leave, a doctor that leaves the United States, Nigeria, a lot of my colleagues, when they get here, even before they get into the system or find a good job, just from driving Uber, they are living a much better life.
Absolutely. Thank
they were
you.
living as a doctor in Nigeria. That
Yes.
is reality.
Yes.
That is reality.
Yes, Mr. Marindoti, you are very right. Now, it's clear that whether you are a financial powerhouse, a famous person, or even just, a low-income earner, you're not protected oftentimes from the failings of the Nigerian healthcare system. And that is indeed a shame. From the woman in Kano who had a scissors left in her stomach to an uber-rich, accomplished author. We are all possible and potential victims of a failing healthcare system. And this seems to be happening at an alarming rate. We are seeing a pattern across government hospitals, federal hospitals, teaching hospitals, and now private, very expensive and elite hospitals like Eurocare. What can this pattern, of failings in our healthcare system across board tell us about the culture we have in the Nigerian healthcare system? I mean, when we look at the fact that there's been allegations of anyhowness. When we look at the fact that apparently the doctor slung the boy over his shoulder, before taking him into theater, whatever the case might be. The fact that this man refused to put the boy in a gurney so that he could actually look at him face to face, to see the color of his skin, to see whether, he was pulsing, to see his eyes, whether they were dilated or not. There's been allegations of a culture of anyhowness. Please speak to this pattern in our healthcare system. What exactly is going on? What does this tell us about what is happening in Nigerian hospitals across board?
Yeah, thank you very much. Just to add to the examples you gave, I know the Senate President Akpabio spoke about how he lost his own granddaughter, like 2 years, a 2-year-old daughter, due to something that happened in university, teaching hospital in Port Harcourt or something like that. So these things do happen. Now, it is essentially, when you talk about the early illness, yes, maybe there's definitely a lot of nonchalance. A lot of doctors might even try to tell you to do a procedure just because they want to make more money, right? It is a lot of things that occur, definitely, when there is nobody torchlighting the decisions of hospitals, when the Ministry of Health, instead of being focused with all these operational challenges, when they are focused on employing people, fighting ARD, fighting these people and that people, fighting Joesu, fighting all of them, they are not going to be doing the job of monitoring, setting the standards they are supposed to be doing. And and that is why I have said it before, that the Nigerian health sector needs a radical reform. We need to switch from government owning and running hospitals to government funding hospitals and demanding outcome. So like this doctor right now that was, that treated this lady, this child in Eurocare, might have a primary place of employment, maybe Lasut or Lut or whatever, whereby he is just doing another hospital, he's just doing another job in that Eurocare. Now, why is this possible? Can you leave your station right now and go to maybe Arise or Channels to go and anchor a program? So why are doctors able to compete with their employer in the same vicinity? Do you understand what I'm trying to say? There are so many things. The reason why this occurs is because of the Yoruba quote unquote Ogata, whether the master sells or the master does not sell.
Important statements, but please hold your thoughts for us. We're going to go on a quick break and we'll be back. Please hold your thoughts. Thank you. You're still watching TVC Breakfast, and we've been speaking to Dr. Marindoti on this very, very crucial issue. Ibrahim, over to you.
Right, thank you, Rhea. Dr. Marindoti, we've gotten different accounts, that of their families and people who are analyzing, and even you as an expert, who is a medical doctor, helping us to understand, this problem, what had led to the death of Chimamanda's son. But we see that Lagos State Health Facility Monitoring and Accreditation Agency, is saying that, they are conducting an independent probe that will examine all aspects of care and hospital compliance. But my question is, what limitations do you consider might be there when forming clinical judgment based on families' reports, anecdotes, of, okay, the doctor, we took the child to the ward, met the doctor flung the child, across his shoulders or whatever, as against formal investigation. When we form this our judgment based on anecdotal accounts, as against formal investigations, how critical do you consider forensic review to unravel what truly transpired that led to the death of Chimamanda's son?
Yeah, thank you. Forensic review is what everybody should be waiting on. But I, as someone that has been in the system, I don't trust forensic review in Nigeria. There is always man, no man, right? So FEMA comes to hospitals all the time. They come to terrorize people. They just come and try to make life difficult. Maybe, I don't know, maybe they want some, kickbacks, whatever, I don't know. But I have seen them come to hospitals and everybody is running around. It is not, you will see that the aim is not about ensuring like a certain sort of type of standard. It's about just coming to show that, yeah, I am like the one that you have to be subservient to for now, and everybody's running around. So when they do, I hope they can get good investigation out of it. FMR is probably not going to be the one to do the investigation. Definitely, it will most likely be the coroner, and the coroner might not be able to even determine if the drug was overdosed because the drug disappears real fast. It gets metabolized into other things real fast, right? So it is very important that we have that detailed investigation and be able to ascertain what this problem is. But this problem, it goes beyond just the healthcare sector. It goes beyond just this particular incident. Every single day, almost every single day, I can assure you there is a start of medical malpractice somewhere.
Sorry, but Dr. Marindoti, sorry to butt in. To place this in proper perspective, when you say you don't trust forensic exercise done in Nigeria, are you trying to say that we do not have credible forensic experts in Nigeria, or because some underhand dealings might actually, be played in the process of unraveling what happened? Could you help us understand what you meant by that very quickly?
Well, what I mean is that there might be some underhand dealings, like it might be essentially a way to maybe quickly get a fall guy. So if the doctor is the easiest to put it on top, and it's always instead of trying to get to the root of the matter, where was the hospital short-staffed, how many patients, what was the patient to nurses ratio, or whatever, do you get? So it is about my own opinion. I don't have a problem with the coroner's inquest. I believe the doctor that is going to do the autopsy or whatever is going to do a good job, right? I don't have a problem with that. I have a problem with the FMR trying to come and investigate. I don't have trust in them. I've seen them come to hospitals where I worked, and the manner at which they approach things it does not suit good intention, in my own opinion. So that is why I said that I don't trust the report. But this is also a pattern of something that is so sad, whereby Nigerians coming home from abroad are being met with tragedy. We saw Chimamanda, she had sorrows. Anthony Joshua.
Let's not go superstition with this. Nigeria is also...
That is it.
No, but Mr. Marindoti, let's not be superstitious with this. Nigeria is a fantastic place. We still have people that came back to Nigeria and they went back, so things happen actually. Right. So let's not try to make our country look like that. But, going forward, let me just butt in and speak on this one. You mentioned so many things that I think that are very crucial. You spoke about shortage of staffs, you spoke about monitoring, but I like to come from an angle that what is the way forward? We're saying government as well. We've been talking about brain drain because our doctors are not being treated right. Most of them are jackpotting and leaving Nigeria, for greener pastures. You also mentioned it that a doctor, overseas will live really good, buy cars, build houses. But when we see Nigerian doctors here, they do not do so well. But we should not use that as a yardstick for them now to start forgetting things in people's tummies and start killing people. So where do we get to, a mutual ground? What is the way forward, with this? What does the government need to do? We've been speaking about, training our doctors, but our doctors as well, do they have enough empathy? Because oftentimes we are just blaming one hand. What about the other hand? And this not me saying that there's not a whole lot that needs to be done, in our healthcare system. But where do we come to a mutual ground that even the doctors, we have them, paying more attention? This issue of negligence has been going on, and it's because these people are popular people. every, 1 or 2 days, people die because of negligence. There was a particular woman that also mentioned that she was asked to, she has to operate her brain when nothing was wrong with her brain. The hospital was saying that because of money. So where does, the humanness actually comes in? Because of our time, quickly.
Thank you. Thank you, Ria. The first thing you said, I would agree with you. But if you had to anchor all the programs in TVC today, you might see Tinubu and say Tinola, right? Because you just human nature.
I always remember my president's name.
But definitely there are some doctors. When you are tired, you might make that mistake. But the doctors also, some are very unscrupulous. Some will, do a lot of things. I had a patient that was told he needed the surgery immediately, or being charged ate bad food, right? And the father was fighting me because he wanted to do the surgery. So definitely the way you can stop it is accountability. There has to be repercussion. That's why what Chimamanda is doing is patriotic, because she can use that clout to get justice. But we cannot absolve Nigeria of problem. Like I was talking about Anthony Joshua, according to the Federal Road Traffic Regulation, National Road Traffic Regulation of Nigeria, no car should be parked beside the highway. Section 188, subsection 4 of that particular regulation. And I know a lot of people have tried to say that truck was parked properly beside the highway. If you look at that car too, you don't see any any airbag coming off. There's a vehicle data recorder. They've not told us the speed the guy was going to, but automatically they are already blaming.
And I'm sure for that, Mr. Marindoti, it was because of the impact. Mr. Marindoti, there's certain speed that you'll be moving on, and the impact will be like that. So let's also put that in context as well. And we also saw how good the roads were. I'm not talking about other roads in Ogun, but that particular road.
Please let me clarify this. There's actually a law that has been passed all over the world since 1999 that all trucks should have like an undercarriage guard, because this is like what killed Dagne. When you drive into a truck that does not have undercarriage guard, it will be at a decapitation level. That was why one of them had their head cut off and all. So there are laws already on the book that have protected against these things that the Nigerian government can enforce. So these things are all part of negligence. If we do detailed, instead of just blaming the driver or just blaming the doctor, if we do detailed analysis, you will come up with a gamut of things. So maybe they will pass a Sonny Latif law that will ensure that all trucks will have that undercarriage guard, so that if a car is going to run under them, it cannot go under it, to push back, engage the crumble zone, and let the airbag come out. That accident could have been easily survivable if not for the level of the truck to the car. So these are the things that we need to do if we do detailed, sincere investigation, whereby you are not just trying to shirk blame or push blame on the easy targets. And your wall So we don't want to do that. We want sincere investigation whereby we will identify the root cause and then create a corrective and preventive measures, be it a legislative.
Okay, but Mr. Marindoti, if you had the power in your hand, what would you do? What do you think are the, let me just say, two most important things that we need to do for our healthcare? Because for me, I always try to look at solutions when we have these conversations. One too many. You mentioned that because of Chimamanda Adichie's clout. What about the people that do not have clout, that cannot fight their battles themselves? So what is the way forward for us to end this negligence and end, people dying in ways that they should not?
The way forward is for the government to rethink its priorities. The priority of the government, of the Ministry of Health, should not be to be employing people in loot or lawsuit or whatever. They should be setting these standards. These hospitals, all hospitals that see Nigerian patients, should have access to federal government funds based on what they see, so that they can focus on ensuring standards and work with the MDCN to be setting punishment and all those things. When the government is distracted with all these building things and all those things, they are not going to do their job. I've said it before. The federal government needs to get out of the business of running hospital and get into the business of owning hospital. Last loot can be better than it is right now if the federal government is not creating this inefficient system whereby they are funding the most inefficient hospitals in the country. If you are talking about what happened in Urake, do you want to know what's happened in last loot, all these federal government hospitals whereby the consultants, you will not even see him. You might be a patient for 3 years, you will not see him for one day. He's doing his private practice. Will you allow that if you were running your own private hospital? No. But this is what happens in federal government hospitals. So the federal government needs to reimagine their own priorities. get out of that business and focus on setting the standard, because they are the ones with the whip that can whip people into line and make sure that we prevent this.
All right, Mr. Marindoti, Dr. Marindoti, it's a fine place to leave the conversation. Thank you so much. You're always very passionate that when you speak, we just hope for the very best. But thank you for joining us this morning on the show. Thank you.
Thank you very much.
All right, ahead on TVC Breakfast, INEC's rejection throws the Labour Party into uncertainty, rising new questions about leadership and party unity. We will discuss this just after the break. Just stay with us.